reiterate. So we do have our next guest joining us. We're going to be chatting with the team over at Vision Express. So let's just say good morning to them. Good morning to you, Dr. Guerra. I hope I'm not pronouncing your name incorrectly, but correct me if I am wrong.
Hello, hello. Yes, Dr. Guerra. Good morning.
Great, great. And so we know that we have an amazing team over at Vision Express, and Vision Express offers so many amazing services. But I know that we will be talking about a few areas, in the coming weeks and months as Vision Express joins us right here on Daily Buzz. So, Doctor, I know that you are busy and a lot of patients are coming in, but I want to say thank you for joining us this morning.
Thank you for having me here.
Great. So at the fore of it, we want to take a look at retinal detachment. So a part of all of the procedures offered from at Vision Express, we're going to be looking today at retinal detachment and educate us and give us more information, doctor, on what exactly is retinal detachment. What does it, what happens, and what should we know about it?
Well, retinal detachment is a condition where some of the layers, internal layers of your eye, they get separate, they get detached from the eye wall. And this is a very, this is a very risky situation because the retina is actually the tissue that sees inside the eye. So
Okay.
for you to have an idea, the retina is an extension of your brain. So when you get your retina detached, you can lose your vision if you don't get it treated properly and in a timely manner. There
Agree.
are several risk factors. There are several risk factors. For example, myope patients, what people call short-sighted people, diabetic retinopathy, ocular trauma, big falls, even the cataract surgery, which is a very common procedure in our field, can lead to a retinal detachment.
Okay. Okay. How frequent is something in terms of retinal detachment? How frequently can this happen?
Well, let me tell you, the retinal detachment have an incidence of about 12.5 cases per 100,000 patients every year. For you to have an idea, 10% of the people of the patients can get a retinal break, which is, by the way, is sometimes the first step to get the retinal detachment. So 10% of the of healthy population can get a retinal tear without knowing that. And on the other side of things, in St. Lucia, the 14.5% of the population is diabetic, which, as I mentioned previously, is a risk factor. And 10% of these diabetic patients can develop a retinal detachment in the future. So we have an issue here. We're talking about, the situation
Okay.
in the general population.
Okay. Now, doctor, in with retinal detachment, is it something that can happen in one eye? Would you see it happening in both? Is it what would be the norm in terms of how it happens? And again, does it occur with both of your eyes?
I mean, most of the time, these persons, these patients, they have the same risk factors in both eyes. So dramatically
Okay.
enough, people that gets retinal detachment in one eye, yeah, for sure, you can get it in the other eye. That's why it's very important to revise your eyes and get an eye check, a proper retinal check, which means that you will need to get your pupil dilated to check the back of your eyes.
And if in giving advice, doctor, how often should we get our eyes checked? And is it a situation where who qualifies in terms of getting your eyes checked? Is it should it only be people who wear glasses, or just in general people should make getting their eye checkups a regular part of their entire medical checkups?
That's a very important question, actually. As I always said, healthy people should, no matter what is your age, should get an eye check every 2 years.
Okay.
If you have one of the risk factor that I was talking about, having uh, cataract surgery, if you are short-sighted, if you got a big blow in your eyes, or this kind of risk factor that I already told you, then you should get. First of all, you should get an eye check right away, and to keep it once every year for sure. If you are one of these patients,
Okay.
um, like I said, it's very very important because sometimes people they ease their mind if they get a a general eye check, and actually they need, like I said, a pupil dilation to check the back of the eye. So that part of the check to check to see the back of your eye while your pupil is dilated is very important. If not, there's no other way to to check the signs that can tell us that you might get a retinal detachment in the future. And there are several symptoms that
Okay.
people need to know so they know if they are in danger or not. So most of the time, the retinal detachment, depending on the cause, uh, they start with, I mean, seeing with people seeing flashlights, or seeing floaters, which is normal until certain point at certain age. But if they get bigger, especially the floaters, if they get darker and wider, then probably you are developing a retinal detachment. Another
Okay.
thing is that the people, they develop blurry vision, and a very typical symptom is like seeing a curtain that is growing on your visual field until you get blind from that eye.
Okay. Now, doctor, you also mentioned one of the risk factors being short sighted, right?
Yes.
Could you explain again exactly what is short sighted? Because I feel like I am one of the two, and I usually mix them up.
Yeah, well, myopia, which is the real name for that, is when you are not able, because of certain features that the eye can have, then you are not able to see from far distance. So these people, they are able to see from short distance
Right.
if they get too close to the object. So that's why that term short-sighted
Right.
people. So they are able to see from near but not from far. So
Okay.
these kind of patients, they develop degenerations on their retinas, and
Understood.
those degeneration can lead to breaks on your retina, and from that then you start to develop a retinal detachment. So that's
Understood.
why it's very important to get these retinal checks, because we are able to see those degenerations or those breaks on time, and we can
Early
treat them
enough.
before you get a retinal detachment. So better not to get there. You get your eye check. If there's something wrong, we can treat it, and that's it. The vision, it never changed.
Okay.
Actually, you don't know what's going on until I
Okay.
tell you.
Understood, doctor. And are there any other ways that it can be prevented, retinal detachment? In addition to, the medical checkups, as you mentioned, doing it frequently and being able to detect it early, are there any other ways you would be able to prevent this from happening?
Well, depending on the cause, because like I told you, the myopia is one of the main causes. But if, for example, if you have a tumor in your eye, you can get the retinal detachment. So being treated this kind of this kind of diseases, then you can prevent yourself having a retinal detachment. If you are diabetic, for example, you need to control your sugar so you don't develop what we call diabetic retinopathy, which at the latest stage can develop the retinal detachment.
Okay.
Okay, so if you, for example, if you are planning to get, that's on our side. If you're planning to get a cataract check, this patient should get a proper retinal check, so we
As
are
well.
sure that you don't have those one of these tears that I was talking about, so we can treat them before the cataract surgery. Because, like I said, cataract surgery is another major risk factor to develop a retinal detachment. So
Okay.
if we can, I mean, during this check, if we detect that you have some of these risk factors, we can treat them right away in our clinic. Actually, for the first time, because this kind of treatment wasn't available before,
Available.
and it's now in Vision, yeah, in Vision Express that we are able to do this kind of retina service.
That is very impressive, doctor. And again, if this is not treated, the retinal detachment, if it is not treated, early enough, detected early enough, and with Vision Express being able to manage and treat early enough, what are some of the complications that someone would be faced with?
Well, this is a very interesting point, actually, because sad enough, sometimes we have seen patients that come to us with a proper referral from their doctors, but they come to us very late. So this is very important for our patients, for illusion people to know that retinal detachment is an ocular emergency. So sometimes they come to us 3 4 months later, and then the results are not the same. Sometimes we are able to reattach the retina, but the vision doesn't improve as we expect.
Wow.
And even sometimes there's no way that we can put the retina back in place. So in this situation, like I said, it's an emergency, and the sooner the better. But I mean, now we are in a very good position because we can treat all of the kind of retinal detachment, no matter how complicated, how complex
Okay.
they are. We have a treatment for all the stages of the retinal detachment. So it's just about to know where to go. In this case, with us, and you will get your right treatment. We are in a very good position right now. We have everything that is needed to treat this condition.
Okay. And doctor, could you give us an idea of maybe what a treatment would consist of?
Okay. Like I said, for example, let's talk about the prevention. If you come to check your retina, and I realize that you have one of these degeneration that I was talking about, we can treat it with laser treatment right away. It's very simple.
Okay.
It's not painful. It takes about 15 minutes. It's just light getting into the eye, and with this procedure, we kind of do a welding of your retina so you don't get the detachment. So the first treatment that we have is the laser treatment.
Okay.
For the less, once you get your retinal detachment, unfortunately, for the earliest stages, let's call it the simpler cases, we have a procedure that we call pneumatic retinopexy, which means that we fill your eye with some gas. This is just an injection, and that don't take. I mean, doesn't take more than 15 minutes to, and we can reattach the retina. For more
Wow.
complicated retinal detachment, we have another procedure that we call sclera buckling, which means that we put an implant, a silicone implant. It's like buckling actually your eye, so we reduce the gap between the retina and the eye wall. And finally, we have the vitrectomy. With this kind of surgery, we can treat every kind, pretty much everything that causing the retinal detachment. Since a diabetic patient that got retinal detachment, if you have a very big eye trauma with hemorrhage and stuff like that, all of that can be corrected with this high tech technique, which is the vitrectomy, like I said. And again, all of this is available right now at Vision Express.
Express. Agreed. Perfect. Doctor, I want to thank you so much. I know that you are busy and definitely the patients are coming into Vision Express. So thank you so much for taking some time out to chat with us and just give us information and talk to us about retinal detachment and what people need to know and the importance of getting regular eye exams and getting regular eye checks. And again, all of that as well can be done at Vision Express. Doctor, could you share the number with us if we need to call in to get more information and to, book an appointment?
I mean, you can go to our webpage. There's all the information because actually we have several branches.
Great.
So there are four offices right now where you can. We have one office actually in Beaufort too. So there are 4 places where you can go. You just
Many
visit our place,
locations.
and yeah, and you will get all that
Perfect.
information.
Great. So, Dr. Guerra, thank you so much again for joining us, and we hope to see you next time on Daily Buzz with more great information. And keep doing the amazing work that you and the team over at Vision Express are offering to St. Lucians.
Thank you very much for your invitation too.
Thank you. Bye bye.
Bye bye.
All right, so that was Dr. Guerra of Vision Express. Again, we were just briefly touching on retinal detachment and just trying to implore you and encourage you to get regular eye exams, whether you wear glasses or not, whether you think something is wrong or not. Make and ensure that regular eye examinations are a part of your overall medical checkups. And of course, you can do that at Vision Express, so be sure to check them out. This is all the time we have on Daily Buzz for today. I want to thank my guest for coming through. Of course, want to thank you for joining us today and keep it locked on to Choice TV coming up nice our lunchtime news.